Welcome back again to my YouTube video channel. Today I will present to you one more case. This is the DeepBite case, and I want to share the slide so we can jump right into and discuss about the case. This video is helpful for dental student, as well as young dentists who want to take the opportunity to learn from online education. And here it is today's case topic is the DeepBite case. And let's jump right in. I have the case, have a lot of picture, but I want to just put together a very short video just to show you how, as a general dentist, what you can do. And so this patient have quite deep bite scenario. You can see if I pull out the cover of his face, you will see that the very concave curve here is with the you can see the very indentation of the lower lip. That is the indication where you can see, yes, you got a deep bite, and you can see the profile. Now, when he smiles, this is the maximum smile that he can smile. Look wonderful, right? I mean, if you are not a dentist, you just say, wow, this is good. But let's just show you guys what the reason why we need to encourage the patient to get a braces. So let's take a look again on the close shot. This is whenever you ask the patient to smile, this is all he can smile. He cannot really smile easily. Got a lip on the upper cover, and the lower lip cover the bottom teeth, and that's the way he is. And so here's how he smile.
Try to have a hard time to
Like to smile.
Once we correct that, I think it's going to be a lot more.
Okay, one more time.
Try to have a hard time to
Like to smile.
Once we correct that, I think it's going to be a lot more.
Okay, so next
Try to have a hard time. Try to have a hard time to
Like to smile.
Once we correct that, I think it's going to be a lot more.
Okay, so I want to move up to the next one. So let's jump into his mouth. Okay, so the reason that we encourage him to get braces is because you can see a lower teeth, number 24 and 25, plaque accumulation easily right here. Also in evidence of incisor edge wear and tear due to the deep bite. Also, you can see that the canine number 6 and number 11 is out of alignment, and so there is no canine guidance, even though it's very nice anatomy of the teeth, but it's not. Also, you can see that there is about almost 80% of the deep bite on A and nice, and so causing the damage up to number 24 and 25. This is the reason why, and we encourage patients to get braces. Also, you can see the tendency of very low, very thin keratinized tissue, and the evidence of parafunctional habit on the posterior teeth. He's only less than 30 years old. So jump right in, as you can see, This is the upper arch. You can see the tooth number A and 9 is lingually inclined, and also the canine is out of the alignment. Also, you can see the arch is narrow from premolar to premolar, and on the lower teeth you got a torice, and also super erupted of number 23 and 26, and there's some spade on the bottom teeth. So you can see there's a issue on when you open the patient mouth, even though you don't see it. So overall, I wanted you to see a whole picture of the patient. Overall, patient have very predictable, nice smile. If he smile big, he can get a deep bite scenario. And so this is how it presented. And you can see there's a, if you look carefully in the lower incisor, there's a damage of the enamel due to the bruxism, the grinding or parafunctional habitry of the lower teeth because of the lingually inclined of the number A and 9 here. So overall, carefully evaluate. This is why you tell patient, encourage patient to get braces. So let's see what we can do. So the goal of this, okay, very, very simple, you guys, is to straighten the patient teeth on the top and bottom and have the patient wear elastic. It's going to reduce the deep bite, and it's going to solve the problem. So the next, you can see that within several months coming in, patient already looking good. I asked patient to wear elastic, pull the teeth together. So you can see start from here, cannot smile really well, to scenario where he can smile really well on this side. So from here, go down here and go here and go here. You can see a very confident smile, more teeth showing, and less tension of the top and bottom teeth. So here again, I just want you to see that the process, only just a few wire, night tie wire can do this job. You will bend a little bit here and there, but it's not very straightforward. So let me start the upper arch right here. Now the wire will make the teeth very straight. You will need some power chain to tie them all up. Bottom teeth with some spade. Wire started. Wire help really straighten it out, and now it's really completely straight. This is the intra-oral anterior facial photo from this DeepBite, to reducing at least 40% deep bite from here. 80% is down to 40% deep bite. That was, and with elastic wearing. So this is how the patient do. This is almost like close to the final. I want you to see again. So this is again, this is irregular incisor showing. Now you can see that more of the straight line or showing to the patient's smile. So this is before, this is after. Again, you can see that before and after, before and after, before and after. You can see basically sides that there is a great improvement of the patient smile. So from this is before, and this is also before, and you can see from here to here during the treatment, and then from here to the final. As I mentioned to you, 80% deep bite, now it's 40% deep bite, and canine is in the close to the canine guidance, and allow patient to eat and chew more proper and smile better. And so here's a quick before. This is after. You can see if I take up his face cover, you're gonna see a lot confidence face and smile. He loved the way he looked, and super happy guy. So from here, even though he could smile, but you can see a little bit more uneasy, natural, not natural smile, but here is completely nice, handsome looking smile with more even on the top. And allow the lower lip to rest exactly on the incisor edge of the teeth, rather than this one have no not knowing where the lower lip supposed to rest. So again, I just want to quickly show you from here going down and see a very nice deep bite corrected on side view, as you can see. Same thing here, guys, from here going down, and from here going down with elastic can be corrected. I want to thank you everyone who watching this, and I hope that you learned something today, and hope to see you guys next video. Thank you for watching. If you like what you see, please don't forget to subscribe to my channel. I hope to see you one more edition.